Hi, I'm Dr. Karam, and I'm a board-certified facial plastic surgeon, and today we're going to talk a little bit about eye rejuvenation. The eyes do not consist of just the upper eyelids or the lower eyelids. When I think about eye rejuvenation, I'm thinking about the entire region encompassing the area of the eye. And the anatomic components of that region are the upper eyelids, the lower eyelids, the corner of the eyebrow, and the volume underneath the eyes. It's important to recognize all these pieces because at the end of the day, the purpose of an eye rejuvenation procedure is to restore the eyes back to its youthful and refreshed look. It is not to change the individual's appearance or to create something that didn't exist before. Another reason why it's important to combine various procedures in this case is because when somebody is looking towards your eyes or in that region, they are not looking at just your upper eyelids, they're not looking at just your lower eyelids, they're looking at that whole area. And the changes that occur as a result of aging create an overall look that is either older or more fatigued. And at the end of the treatment, what we are trying to do is restore things back to the more youthful configuration. And ultimately, will give the person the most natural and refreshed look possible. Looking at the individual parts separately, the changes that occur in the eye region are that the upper eyelids typically generate more skin. This is a process called dermatochalasis, which is simply that you get extra skin on the upper eyelid region. The treatment for that is an upper eyelid blepharoplasty. Once it's performed, in addition to the aesthetic benefits of having upper eyelid blepharoplasty, there's also a functional enhancement. And patients will note that they feel much lighter and more refreshed just from the opening and closing of the eyes. The other part of the eyes that begin to age are the lower eyelids. We perform a technique called a skin pinch, which a small incision is made a few millimeters below the lower eyelid in the lower eyelid crease, and the extra skin is pinched and removed. Looking beyond the eyelids, we see that in most patients in their 40s and beyond, there's a loss of volume in this area. And this change is equally as important as the extra skin that accumulates, and as a result, requires the same deliberate correction and attention. And when it's done properly, patients look natural, and they look rejuvenated, and they're highly satisfied with their outcomes.